Okay, hello and good day. Again, my name is Teacher JV, and today we will be learning about your chapter 8. And we've already finished with your muscular as well as your skeletal system. And this time we'll be learning about your nervous system. So basically, the nervous system is deemed to be part of every body functions that is happening in our body. And our nervous system is our body's command center as well. It guides almost everything that we do, like the things that we think about, the things that we say, and also the things that we feel. It is always guided by your nervous system. So it is also the center of all the mental activity, including our thought, our learning, as well as our memory. So are you guys ready to learn this system? Okay, awesome. So again, we have the same thing that we should do. You go over your books, you read along with your book, you write down notes, and try to learn the concepts um, properly. Okay, and we will be starting here with the functions of your nervous system. The first one here, it's all about your sensory input. So it says here the sensory receptors respond to stimuli. Okay, so what is happening here is the sensory input are the awareness that we experience with the use of our senses. Remember, we have our sense of sight, hearing, taste, smell, and also touch. Okay, now, we also have the stimuli process that are subconsciously the likes of your blood pH, the blood gas, and the BP. So these are the input that usually happening in our senses. Now, how about your integration? It says here that we have the brain and the spinal cord stimuli. So the process of integration actually combine your sensory perceptions and higher cognitive functions such as the memories, learning, and emotion to produce a response. Okay, so it will integrate everything that is perceived by our senses and it is being interpreted by our brain. Okay, now how about the control of muscles and the glands? So basically here, it says that the skeletal muscles normally contract only when stimulated by your nervous system. Okay, thus we can actually control the muscles, the nervous system controls the major movements of the body. Okay, and it also contribute or participate in controlling your cardiac muscle, the smooth muscle, and many glands. And of course, in our nervous system, we have our brain, which is the one who is responsible for our mental activity. Okay, and the memory, the thinking, our consciousness as well. Well, your homeostasis, you already know what is your homeostasis, right? So the nervous system actually plays an important role in maintaining our internal state. Okay, so these are the few of the many functions of our nervous system. Now let's go here. What I want you to know here is that the main divisions of your nervous system. Okay, when we say nervous system, it is divided into your two major components, which is your CNS and your PNS. If we say CNS, it is comprised by the brain and also your spinal cord. Okay, this is your CNS, your central nervous system. While your PNS, on the other hand, your peripheral nervous system, are all neurons outside your brain. Okay, so everything, every neurons that is outside your brain, it is already part of your PNS or your peripheral nervous system. And we'll be learning more of this as we go along with our session. Now let's go here and let's learn about the neuron characteristics. So if we say neuron, these are your nerve cells. They require oxygen and also glucose. and they receive input, process input, produce also a respond. Okay, as you can see this one, this is the structure. This is the structure of a neuron. Okay, you can look at this one on your book so that you can have a clearer view. It's on page 194. So this one is your neuron and these are its parts. So we have what we call your dendrite. Okay, this one, this part, this is like the finger-like structure here. These are what we call the dendrites. This one, they receives stimulus from other neurons or sensory receptors. The one who are receiving dendrites. Okay, now let's go to your cell body. Okay, this part here, this is what you call your cell body, and as you can see, there are many things here that are quite familiar already with you, right? Your mitochondria, your Golgi apparatus, nucleolus, nucleus, and your rough endoplasmic reticulum. Okay, so this one comprises the body of your neuron, and here this is where they process the stimulus. So after the dendrite receive the stimulus, it will be processed here in the neuron cell body. Okay, and here on the lower part, we can see here, these are what you call your axon. Your axon, they transmit the stimulus to the gland, muscle, organ, or other neuron. Okay, so this is how the stimulus is being received, being processed, and being transmitted. So first, again, it will be received by your dendrites, and then it will be processed here in your cell body. Eventually, it will be transmitted from your axons. Okay, please remember all the parts of your neuron structures. Moving on here, we have what we call your myelin sheet. Okay, so as you can see here, myelin sheet, these are the fatty protective wrapping around the axon, and they are excellent insulator. Now let's go here. So as you can see here, these are your myelin sheet. Okay, so again, these are the fatty protective cover of your axon. So what are they? So as you can see here, we have two categories for this one. We have your myelinated axon. We also have your unmyelinated axons. Okay, and we also have here your node of Ranvier. This one, it says here that there is no myelin sheet on this part. So gaps in your myelin sheet where action potential is developed. Okay, where does the action potential develop? It is on your node of Ranvier. Well, here, your saltatory conduction, jumping of action potential. Okay. Now, myelinated axon conduct action potential more quickly than unmyelinated due to your nodes of Ranvier. Okay. Moving on here, we have this so-called multiple sclerosis. Okay, your multiple sclerosis, this is the disease of the myelin sheet that causes loss of muscle function. Okay, so if you have damages in your myelin sheet, there's a big probability that you will be having your MS or your multiple sclerosis. And here are your symptoms actually. Like you have a poor vision, and then you have problems with your spinal cord, and then there is a difficulty of you to perceive your sense of touch. Maybe there's a possible that you cannot distinguish hot from cold, something like that. There are problems. Okay, the muscles, your urinary, and many things. It is because it is your neurons are actually damaged. Okay, you will learn more of this one if you will go to your medical and surgical nursing if you're already in your third year levels. Okay, now moving on here, this one you can just check this one on your book. This is just an illustration of the continuous conduction in unmyelinated axon. Okay, remember again that your myelinated axon conduct action potential more quickly than your unmyelinated axon due to the nodes of Ranvier. Okay, and here is another illustration, but this one is more of your saltatory conduction. Okay, your saltatory conduction. This is the action potential conduction in your myelinated axon. Please refer to your book with this one. The explanation is actually very easy to learn. Okay, so let's move here to your types of neurons. Okay, so there are apparently three categories, or there are three types of your neurons. And as you can see here from its structure, you can actually identify it already. Okay, based on its arrangement as well. Okay, now let's go here for the first one. Okay, this is your multipolar neuron. Okay, your multi, of course, from the multi means many, like it has many dendrites. Look, it has many dendrites and an axon. Okay, here many dendrites and a single axon. Example is the CNS and most of your motor neurons. This is multipolar neuron. Now let's go here. Bipolar, it means two. Okay, bipolar has dendrite and it also have your axon. Now one dendrite here and one axon, compared here that it has multiple dendrites, right? So here example are the things that you can find in your eye and also your nasal cavity. Well, here we say a pseudo unipolar neuron. I hope you already know the meaning of the word pseudo. Okay, your pseudo unipolar neuron appears to have an axon and no dendrite. This one, it looks like dendrites, but they're not actually. These are your sensory receptor. But your pseudo unipolar, it has axon. Okay, one axon and no dendrites. Usually you can find this one in your sensory neurons. Again, what are the three types of your neurons? You have your multipolar neuron, bipolar neuron, and your pseudo unipolar neuron. Okay, you can read the table 8.1 so that you can properly categorize the difference between among the three. Okay, going here, what we have what you call your neuroglia. Okay, your neuroglia, these are the supporting cells for your neurons, more numerous than neurons and can divide to produce more cells. And it has 5 types. As you can see here, this one. And then here, it has more neuroglia cells rather than your neuron. Okay? And it has 5 types. Please remember these 5 types. First one, we have your what we call your astrocytes. Okay, your astrocytes here is star shaped. That's why it is called astro, because the shape is looking like a star. And this is most abundant and can form blood-brain barrier. Okay, so this is actually very abundant in your central nervous system, and they have many radiating processes which help in clinging the neurons and also your capillaries. Okay, and they support and brace the neurons and anchor them in the nutrient supply lines. They also help in the guiding of the migration of the new neurons. Okay, now here the next is what we call your ependymal cells. This is produce and circulate in your CSF or your cerebrospinal fluid. Okay, in your cerebrospinal fluid or your CSF. So this one, as you can see here in our illustration, it is ciliated, or it has cilia. Okay, so your ependymal cells are ciliated and line in the central cavities of the brain and your spinal cord. Okay, and they form your fairly permeable barrier between your cerebrospinal fluid that fills these cavities and the tissue cells of your CNS. Moving on here, we have what we call your microglia. Okay, as you can see here, it says that your microglia, they help remove your bacteria and cell debris from your CNS. Okay, and they are actually small and ovoid in shape, as you can see here. And they have thorny processes, just like this, like small branches. Okay, and they are usually found also in your CNS. And this is the most thing that this microglia do, is that they remove bacteria and cell debris. Okay, and what is happening is when invading like microorganisms or dead neurons are present, these microglia can actually transform into your phagocytic macrophage. Remember, like if we say phagocytic, they can actually engulf or they can actually ingest, right? And they will help cleaning the debris in our neurons. That is your microglia. Now, moving on here, we have your oligodendrocytes. Okay, your oligodendrocytes, they produce your myelin sheet in your CNS. Okay, they produce the myelin sheet in the CNS, and also it is found in your CNS. Okay, and we have here what we call your Schwann cells. Okay, your Schwann cells produce myelin sheet in your PNS, in your peripheral nervous system, while your oligodendrites in your CNS. In your PNS, it is your Schwann cells. Okay, and they actually surround all the nerve fibers in the PNS, and they can actually be found. They are found in your PNS, and the function here is, of course, the same as this one. Let's look closer here again if we can see. Okay, there you go. So this is an example of your Schwann cell, and they are in your PNS. Okay, moving on. So again, the types of neuroglia: astrocyte, ependymal, your microglia, oligodendrocytes, and your Schwann cell. Okay. Description here. Okay, this is the description I mentioned a while ago, where you can actually check on your book. Now let's go here, the organization on your nervous tissue. So what we have here is your gray matter and your white matter. So your gray matter, collection of dendrites and the cell body. As you can see here on the part of your brain. Your white matter, collection of axons and their myelin sheet, which is here. Okay. Okay, comparison of your CNS and your PNS. CNS, we have your oligodendrocytes, which produces your myelin sheet. In your PNS, it is your Schwann cells. Collection of axons. In your CNS, you have your nerve tracts. In PNS, we have your nerve. How about the collection of cell bodies? In CNS, your nuclei, and in your PNS, it is your ganglion. Okay, now here, this one, this is about the electrical signals and neural pathways. Okay, we've already learned about your resting membrane potential. So please revisit this concept about it is outside of the cell is more positive, like your sodium ions. The inside of the cell is more negative, like your potassium ions. And we also have your leak ion channels, always open because of your potassium ion channels. We also have your gated ion channels, closed until open by specific signal. Okay, leak ions, gated ions. Okay, moving here. This one, you can just check this one on your book. It's actually easy to understand if you will go with the flow. And let's go here now to your AP, or your action potential. So we have here electricity that causes the depolarization and your repolarization. You positively charged or you're negatively charged. Now change in resting membrane by potential by activating your gated ion channels. Again, who will activate your gated ion channel? Is it your sodium or your potassium? Okay, it is your sodium channels. Now let's go here. We have your local current movement of your sodium ions, which causes the inside of the cell to be more positive or depolarized. If enough sodium ions enter, then threshold is reached and more sodium ions channel can actually open. Once threshold is reached, all or none law applies. Action potentials continue until sodium ion channels close and your potassium ions channel open, and we will be having your repolarization. Okay, and we also have your sodium potassium pump restores. Okay, as you can see here in this illustration, this is the voltage gated ion channel and the action potential illustration. Okay, this one is actually easy to understand. The first part here, this is all about your resting membrane potential. Okay, and here this is your depolarization. Okay, like this one is also in your book. Your repolarization, the description is like this one. Okay, moving on here, as you can see, this is your action potential. So if you will look here, we have here -70, we have here 0, and we have here your positive 20. So this part here in your resting membrane, it is usually in your -70. Okay, so during the depolarization phase, the voltage across the cell membrane changes from approximately -70 to your positive 20 here. Okay, so this one here, this is your depolarization phase. Okay, and then eventually during your repolarization here, so from it will go back to your -70. Okay, and then there's at some point you will be experiencing your hyperpolarization here. Okay, and this one says that it is the entire process lasts 1 or 2 milliseconds. Okay, so that is how your action potential occurs here. Now moving on here, we have what we call your synapse. Okay, I think we've already discussed this one from the previous system, so you already have what is ideal about what is your synapse all about. So what is it? It is where an axon attaches to the muscle gland, organ, or other neuron, and it involved with the release of your neurotransmitter. Okay, example here is neuromuscular junction. Okay, so what is happening here? It is actually also, it's easier to understand if you have your book and you can follow the process of how it is actually being occurred. So we have here again your AP, your axon potential here. So you can see the number 1. What is happening here, it will arrive again in your presynaptic terminal, and once it will arrive here, it will cause your voltage gated calcium ion. This one, this is your voltage gated calcium ion. It will cause it to open. Okay, now once this one is open, your calcium ion diffuses into the cell and causes a synaptic vesicle to release your neurotransmitter. Okay, so you can see here calcium ion, and then it will diffuse here on your synaptic vesicle. Once it is diffused there, they will release your neurotransmitter molecule. Let's go to the third one. So the neurotransmitter molecule here, it will now diffuse from the presynaptic terminal across your synaptic cleft. Remember, your synaptic cleft is the space in between, right? Here, so it will go here. So from your presynaptic, it will go here to your synaptic cleft. Now, what will happen here? Let's go here to your number 4. Your neurotransmitter molecule combined with the receptor site. Okay, here. And then it will cause your chemically gated sodium channel to open. Okay, now the sodium ion diffuses into your cell and causes changes in your membrane potential. And eventually this one, again, this is your membrane, it will now open. It's because this one is already activated. It will open, so your neurotransmitter can actually pass through. Okay, moving on here. Here are the example of your neurotransmitter. We have your acetylcholine, your norepinephrine, your serotonin, dopamine, your GABA, your glycine, and your endorphins. Just read this one. These are good to know as of the moment. And let's go here. Let's talk about your reflexes. Okay, so if you say reflexes, what are they? They are the involuntary response to stimuli. As you can see here in our illustration, like this is like checking the knee of the patient. So this is your external stimuli, and then it will tap the knee of the patient, then eventually it will have your respond. Okay, usually the response is what we call your reflex. Okay, so if we say reflex are path reflex travel. Okay, so let's learn more. So we have here your components of your reflex arc. Okay, so as you can see here how these things are happening, or how do we usually produce our reflexes. So we have here your sensory receptor, the first one here. Okay, here. So we're going to pick up the stimulus. Okay, it's coming from the external, like someone pinch you, or someone like tap your knee during your physical evaluation or exam. So that one, your skin will actually pick up your stimulus. Okay, then it will travel here in your sensory neurons, or your afferent, sensory afferent neurons. What is happening here, once the stimulus is being picked up, okay, your sensory neuron will actually send the stimulus here on the third one. This is your interneurons association neuron, okay, in which it is located in your central nervous system and connect to your motor neurons. It is where here that the stimulus is being processed. Once it is being processed, it will now go to your motor neuron, or your efferent. And then here, it will now send the response to your effector. Okay, the effector here is your muscle, your gland, or your organ. They are the one who will actually do the reflexes. Okay, like suddenly someone like tap your shoulder, and then you will get shock, and then eventually like you will your body will eventually jerk, and then you will look at the person. Okay, so this is how actually the reflexes are being interpreted. Okay, now let's go here. So what we have, your your neuronal pathways. Okay, so if we have your neuronal, we have actually distinguish it as your converging or your diverging. Okay. Now, as you can see here, look closely to the illustration so that you can properly distinguish what is your converging and what is your diverging neuronal pathway. So if we say here, you're converging, which is this part, your two or more neurons synapse the same neuron. Okay. While here, diverging axons from a neuron divides and the synapse with more than one neuron. Okay. So divergence actually allows one neuron to communicate with many neuron network, while your convergence allows a neuron to receive input from many neurons in a network. Okay, so that is your converging and diverging neuronal pathway. Moving on here, we have your central nervous system. Okay. Again, your central nervous system consists of the brain and your spinal cord, and the brain in brain case. Okay, as you can see here, and also this is your spinal cord vertebra or your vertebral column. Now let's learn first about your spinal cord, and they extend from your foramen magnum. Again, remember what is your foramen magnum. It is the hollow opening here in your brain, right? Which connects the spinal cord to the actual brain. So it extends from your foramen magnum to the second lumbar vertebra. Okay. Here, so here is your second lumbar vertebra. So that is your spinal cord. From this one until here, it is protected by your vertebral column, and spinal nerves allow movement. If damaged, paralysis can actually occur. That is why it is very important not to touch a patient in your if they are in motorcycle accidents or MVA. Okay, it's because there is a proper way on how to treat the patient or how to handle the patient. Do not drug the patient or do not move the patient without proper knowledge. It's because it can actually lead to your paralysis. Now, moving on here, we already talked about this one a while ago. Your gray and also your white matter, but that one is on brain, but this one is on your spinal cord. The center of spinal cord is the gray matter and it looks like letter H or a butterfly, while your white matter outside of spinal cord and contain your myelinated fibers. Okay, I think there you go. We have illustration here, but before that, let's talk about the white matters in your spinal cord. Contains your three columns: dorsal, ventral, lateral. Again, if we say dorsal, behind, ventral, center, lateral on the side. Okay. Ascending, it means going up or towards. Descending, it means going down or away. Okay, so we have your ascending tracts axon that conduct action potentials toward your brain, while your descending tracts axons that conduct action potentials away from the brain. And as you can see here in this illustration, it's how are you going to look at it. There you go. So again, this is the it looks like a butterfly or letter H. That is your gray matter, okay, in your spinal cord. And this one, we have three parts here. We have your posterior, lateral, and anterior. As you can see here, in your posterior horn, it actually contains your axons, which synapse with your interneurons. Here, your lateral on the side area, it contains your somatic neurons. Anterior, the one in front, this one, This contains your autonomic neurons. Okay. Now let's repeat. Posterior, what does it contain? Interneurons. Anterior, your somatic. Your anterior, your lateral, that is your, this one, lateral, it contains your autonomic. Your anterior here, it contains your somatic. Okay. And as you can see here, there's like a small hollow here. That is what we call your central canal. And your central canal, it is fluid-filled space at the center of the spinal cord. Okay. As you can see here, another illustration. Now let's move here. How about your spinal nerves? Okay, so your spinal nerves, this arise along your spinal cord from the union of your dorsal and the roots of your ventral roots. So dorsal roots and your ventral roots. They contain axons, sensory and somatic neurons, and it is located between your vertebra. Okay, and it is categorized by region. So we have your cervical, thoracic, lumbar, sacral, and of course this is your coccygeal nerves. Okay, or where you can see your coccyx. Okay, and it has 31 pairs, and it is organized in your 3 plexuses. Okay, so we have here your cervical plexus. So we have your C1 to C4. Your C1 to C4 here, spinal nerves, innervates muscle attached to your hyoid bone and the neck. This one, it contains your phrenic nerve, which innervates your diaphragm. Okay, again, C1 to your C4. That is on your cervical plexus. Now, how about your brachial plexus? It will start from your C5 here until your T1. This one. So we have 1, 2, 3, 4 cervical, and we have 1 thoracic. Okay, that is your brachial plexus. C5 to T1. Supply nerve to your upper limb, your shoulder, and your hand. Okay. How about your lumbosacral plexus? A combination of your lumbar region and your sacral region. Lumbosacral plexus originates from your spinal nerve L1. Okay, here your L1 to your S4 until here. Okay, this one supply nerve lower limbs. Okay, so this is your spinal nerves. Okay, for further illustration, you can read this part on your book. Now let's go here, your CSF, or what we call your cerebrospinal fluid. These are the fluid that bathes the brain and also your spinal cord. Okay, and the discoloration of this one, it means that there's something wrong. Okay, it provides a protective cushion around your CNS and produced in your crocoid plexus of the brain. Where you can see this one, it is here. This is your crocoid plexus where your CSF is being produced. Okay, now let's go here. This is now what we call your brainstem. Okay, so your brainstem, okay, where is it? This one. Okay, this part of your brain, this is your midbrain. We have what you call also your pons and your medulla oblongata. So these are your components of your brainstem. Okay, so the first one here, your medulla oblongata, which is this one here. It is the location of this one. It is continuous with your spinal cord. So what is the function of this one is it regulates your heart rate, the blood vessel diameter, your breathing, swallowing, the vomiting, hiccuping, hiccup, coughing, sneezing, and balance. Okay, that is about your medulla oblongata. Now we also have, let's go here a bit higher. This one, the center part of your brainstem, which is what we call the pons. It is above your medulla oblongata and bridge between your cerebrum and your cerebellum. What is the function of this one? It is also for the breathing and also for the chewing, salivation, and swallowing. Okay, this one will be, it will be stimulated if you see something like food that will actually make you salivate. Okay, it is actually your pons. Now going a bit higher, that is what we call your midbrain. Okay, this is above the pons. This one is, the function is more of coordinated eye movement, pupil diameter, and turning head towards your nose. Okay, toward noise rather. This is your midbrain. Brainstem, it has 3 components: midbrain, pons, and medulla oblongata. Clear? Okay, that's awesome. Now let's go here. Moving on with your diencephalon. In your diencephalon, it is located here between your brainstem and your cerebrum. This is your cerebrum. Okay, and it has your thalamus and your hypothalamus. Okay, I know you're already familiar with these terms. Okay, let's discuss first your thalamus. As you can see, this one, this area here. Okay, your thalamus, this is the largest portion of your diencephalon. And the function, this one, it influences our mood and the one who can detect actually the pain. Okay, if we were pricked or we were hit by something, it is being detected by your thalamus. Okay, now let's move to the next one. We have your hypothalamus. Your hypothalamus, it is located below your thalamus. And this one usually, the characteristic is controls your pituitary gland and is connected to it by your infundibulum. The function of this one, it controls your homeostasis, our internal state. Okay, and also your hypothalamus, they control our temperature. Okay, they can detect if we have elevated or we have low body temperature. And also the thirst, it is also the thirst center of our body, your hypothalamus. And also the hunger, fear, rage, and also your sexual emotion. Okay, or if you're feeling a bit of sexual tension or anything that has something to do with your sexual, it is actually your hypothalamus. Okay, we cannot see here, but we actually have your epithalamus. It is just a notch above your thalamus. Okay, and it is actually more of your emotion and visceral response to odors. That is your epithalamus. Again, remember epi. Okay, it is above. Now let's go here. Oh, another illustration on how you're going to see this one is your thalamus. Okay, there you go. We have your epithalamus here, and here is your hypothalamus. Okay, and those are your diencephalon. Moving here, we have actually your cerebrum. Your cerebrum is the largest part of the brain. We have your right, we have your left hemisphere, and it is separated by your longitudinal fissure here. Okay, we also have your lobes. I hope you're already familiar with the lobes of the brain. We have your frontal lobe, of course, the one in front, parietal one, notch above your frontal, and then your occipital is the back part, and your temporal is on your sides. Okay, those are the lobes of your cerebrum. Okay, and here, if we say your left hemisphere usually controls the right side of the body, okay, and responsible for our math, analytic, and speech. Okay, and usually, like if someone got stroke, and the brain part that was actually damaged is your left hemisphere, the body that is the the side of the body that is being affected is the right side. Okay, now let's go here in your right hemisphere. This one controls the left side of the body, so this one is responsible for music, art, and abstract ideas. So there are people who are saying that, oh, I have my left hemisphere is actually more inclined compared to my right, so it means that I am good, I am better in math or analytic or speaking, something like that. Or you can say that, oh, my right is more dominant than my left hemisphere, so I am more of music, art, and abstract, something like that. Okay, let's go here to your cerebrum components. So you can see here we have your corpus callosum. Okay, this one, this part, that is your corpus callosum. This one is connection between your two hemispheres. Okay, and we also have here your cerebral cortex. Okay, it controls actually our thinking, our communication, our how we remember things, how we understand things, and also on how are we going to initiate involuntary movement. And you can find this one in the surface of your cerebrum and composed of your gray matter. Okay, as you can see here, we have here your is this gyre? Yeah, I think so. This one is the folds. As you can see here, these are the folds on your cerebral cortex that increase surface area. You also have your sulci here. Okay, these are the shallow indentations, as you can see here. Okay, that is what you call your shallow indentations. And your fissure. Okay, if we say fissure, it is your deep indentation. If it's shallow, it is your sulci. Okay, now let's go here. How about the lobes of the brain? Okay, if we say lobes of the brain, it is your frontal, parietal, occipital, and your temporal. Okay, let's talk about your frontal here. This one, the front side of your brain. Okay, here, if we say frontal, it controls the voluntary motor functions, the aggression, and also our mood, and how we smell things. That is your frontal. While here, your parietal, this one on the top portion of our brain, this one evaluates the sensory input. Okay, so it will evaluate our pain, our touch, the pressure that we feel, and also the temperature and the taste. Okay, while your occipital, okay, the back portion here, this is more of our vision, the way we see things. It is here in your occipital lobe. While the last one here, your temporal, on the sides, both sides of your head. This one is more of the hearing, the smell, and your memory. Okay. Moving on here, let's go to the next one. We're going to talk about your cerebellum. Okay, your cerebellum is this one, or here on the other part, this one. Okay, the cerebellum, they're saying that this is like the little brain. Okay, and it is below your cerebrum. This one is more of controlling the balance, our muscle tone, coordination of our motor movement. Okay, this one, as you can see here, it is actually composed of gyrus, sulci, and gray matter. That is your cerebellum. Now let's move to your sensory functions. Okay, if we say sensory function, it is your central nervous system constantly receives sensory input, and we are unaware of most of our sensory input, and sensory input is vital of our survival and normal functions. Okay, look at this one. This is your ascending tract. Again, if we say ascending is going up. Okay, so what are they? These are the pathways in your brain and spinal cord. So look at the green ones. Okay, so what is happening here is they transmit information via action potentials, your AP, from the periphery of your brain. Now, each tract has limited type of sensory input like temperature, touch, pain, and etc. Tracts are named that indicated origin and termination. It is made of 2 to 3 neurons in sequence. Okay, so from the periphery of the brain and your spinal cord, this is your ascending tract. Okay, now let's go here. So your sensory area of your cerebral cortex. So we have here, this one is more of your sensory. This part here is more of our motor. Okay, now it says here, your primary sensory areas is where ascending tracts project and where sensations are perceived. It means this part here. So we have your primary somatic sensory cortex, general sensory area. It is in your parietal lobe. Sensory inputs such as pain, pressure, and temperature. Now here on the other side, this is your motor areas for the cerebral cortex. Primary motor cortex, frontal lobe. Okay, here in the front. Controlled voluntary motor movement. Your premotor area is your frontal lobe, also where motor functions are organized before initiation. And your prefrontal area, motivation and foresight to plan and initiate movement. Okay, it is where you can actually locate these things. So again, if we go with your sensory area, it is more on the parietal lobe. Your motor area, it is more on the frontal lobe. Okay, how about your descending tracts? Okay, this one is the purple one. Your descending tracts here project from the motor neurons in your cerebral cortex to lower motor neurons in your spinal cord and brainstem. And this one controls different types of movement. Okay, another illustration here. This one is your, okay, that one is your descending tract. Now let's move here to your basal nuclei. Okay, as you can see here, this is your basal nuclei. And we have here, there you go. So these are actually a group of functionally related nuclei that is usually responsible of our planning, organizing, and coordination of motor movements and also our posture. Okay, so it has two things here. It has two subdivisions, your corpus striatum and your substantia nigra. Okay, your corpus striatum is in your deep cerebrum, while your substantia nigra is in your midbrain, as you can see here. And here is your corpus. Okay, how about the speech? Our speech is actually here. We have mainly Again, this is on our left hemisphere. Okay, so we have your sensory speech, or what we call your Wernicke's area, which is located on this part, on the parietal lobe area, where words are heard and comprehended. While here we have your Broca's area. This one is more on your frontal lobe. This is where words are formulated. Okay, so when you hear a word, okay, it is actually being comprehended in your Wernicke's area on parietal. And if you're going to respond, you're going to say a word, it is being formulated in your Broca's area. Okay, is it clear? Sensory speech, Wernicke's, motor speech, Broca's. Okay, so we also have this one. This is your brain waves and consciousness used to diagnose and determine treatment of your brain disorder. So what we are usually doing here or using is your EEG, or electroencephalogram. Electrodes plated on the scalp, as you can see here on the picture, to record the brain electrical activity. So we have here alpha, beta, theta, and also your delta. So what are the difference here? If we say alpha waves, the person is awake in quiet state. Okay, if we say beta waves, this is our body or our brain is having an intense mental activity. Your theta waves, we are in our deep sleep. Well, no, let's go back. Beta, here, your beta is more of mental activity. Okay, here your delta, this one, delta is more on deep sleep, and your theta, this one is usually can be seen in children. Okay, now let's go here. The memory process, how we usually do this one. So we have actually 4 in our book. It is actually 4. So we have your encoding, consolidated, and storage, and retrieval. Okay, so as you can see here in the picture, if we say encoding, it is like more of a brief retention of sensory input received by the brain while something is scanned, or if we are reading something, if we are evaluating something. You can this is actually also called as your sensory memory. Okay, usually we can find this one in your temporal lobe. Okay, and it actually lasts for a few seconds. Okay, and here the second one's your consolidated. This is where the data is being encoded. Okay, it is being encoded again in your central temporal lobe. And this one is also your STM, your short-term memory. While your storage, this one is more of your long-term memory. Okay, this one, it is more of few minutes or permanently. It depends on the retrieval. Your retrieval, how often the information is actually being used. Okay, again, so the memory process, we have your encoding, consolidated, storage, and your retrieval. Okay, now moving on here, the types of memory. You already know these things. You have your STM. If you really want to forget something, oh, I have a short-term memory. If you don't want to talk about something, you will just say to the person that, oh, I have short-term memory, I don't want to talk about it, I forget anything about it. Okay, information is retained for a few seconds or minutes, and bits of information. Okay, long-term memory, this one can last for a few minutes or permanent. Okay, usually this refers to the storage of information over an extended period from the things that we've learned since we are in grade school, we are in high school, senior high school, you know, the things that we still know. Okay, they are actually filed on your long-term memory. Your episodic or memory, this one tackles more of the places or events that we experience. Okay, this is like a your conscious recollection of personal experiences, like when you go to some place, like it seems like I've been here, something like that. If you experience something, it it seems like I already felt this kind of phenomena. This is more of your episodic memory. Okay, like the things like deja vu, something like that. Next one, we have your learning. This is utilizing past memories. Again, these are the things that you've learned before, and then eventually you're using it. Example is you've already learned something about body parts in your senior high school, then eventually you're utilizing that memory to now that you're learning anatomy and physiology. Okay, it's like a continuous, or you're adding more information. Okay, that is your learning. Now let's go here. We have what we call your meninges. Okay, the meninges, they're actually the protective wrapping or covering around our brain and our spinal cord. As you can see here, okay. So these are the very important things in our body, so that our brain and spinal cord are actually protected. Now, if you have infection of your meninges, we term that as your meningitis. So every time you hear or you learn or read itis, 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 it means infection. Okay. So let's go here. Meningitis are the infection of your meninges. Usually it can be bacterial or viral. I've encountered a lot of patients like this before when I was still working in the hospital, and so it's more of antibiotic medicine. Okay, so as you can see here, we have your types of meninges. Your types of meninges here. Okay, example, this is the scalp part, and then this is your skull. And the first layer here, this is what we call your dura mater. Your dura mater, it is more of the superficial part of the three parts of your meninges. Okay, this is your dura mater. They're actually the thickest layer. So we have your perosteal, we also have your meningeal. Next one, the second layer here is actually your arachnoid mater. This one, your arachnoid mater, this is your second layer. And as you can see here, the one that is separating your arachnoid and your pia mater, that is what we call your supraarachnoid space. Okay, this is where your cerebrospinal fluid sits. Okay, so next to that one is your pia mater. This one is the third layer, and it is already on the surface of your brain. Okay, again, dura mater, arachnoid mater, and your pia mater. And here we have your subarachnoid space, where the CSF sits. Okay, moving on. Okay, this one, we usually also perform this one in the bedside and or in the operating room. Okay, your spinal block and spinal tap. If we deem or we think that the patient is experiencing meningitis, we'll be taking examples of your cerebrospinal fluid, and then we will send it to the laboratory for proper diagnosis. So the process is something like this. So the patient will lie down on the lateral position like this, wherein this part of your body should be very prominent, so that the doctor can actually check or can actually insert the needle properly. Okay, so we have here your epidural space in vertebral column between your dura and vertebra. So you can see here, this is your dura mater, and this is your epidural space. Okay, now injection site for your epidural anesthesia. We also do this one for patient who do cesarean section. Okay, spinal block and spinal tap in subarachnoid space. where cerebrospinal fluid can be removed or anesthetic inject. It will numb your spinal nerves. Okay, moving on. So these are other illustrations. Okay, other part, we have your ventricles. Okay, your ventricles, they are the cavities in your central nervous system that actually contain fluid. Okay. We have your fourth ventricle here, base of your cerebellum, continuous with central canal of your spinal cord. This one is your fourth ventricle here. Okay. And your ventricles here. Okay, that is all about your ventricles. How about your cranial nerves? Okay, this one is very, very important. What I want you to know here is you should memorize this. Okay, from cranial nerve 1 until the cranial nerve 12. Okay, this is very important. So in cranial nerves, we have actually 12 pairs. Okay, and they are named by Roman numerals, so 1 to 12. And you have your two categories for this one. So we have, according to its function, so we have your sensory and we also have your motor. Okay, again, I am emphasizing that it is very important for you to memorize your cranial nerves. And we have a way for you to properly memorize this one. Okay, so you have your mnemonic, like your O to touch and feel very good velvet, such heaven. This is actually the conservative mnemonic. We have other mnemonic, but it doesn't sound good. Okay. Now, again, O to touch and feel very good velvet, such heaven. Okay, your O. First O, it is your olfactory nerve. Okay, your olfactory nerve. Specific function, it is for your smell. Second one, O, optic nerve, your CN2. Okay, it is also sensory. This one is your vision. Okay, the third one, the third O is your oculomotor. Okay, this is a combination. It can be M and P. It says here motor to 4 or 6 intrinsic eye muscle and upper eyelid, parasympathetic constriction of pupil and thickens your lens. Next, your 2. The first one is your trochlear. This one is motor. This one is for the extrinsic eye muscle. The next T is your trigeminal. This is both sensory and motor. Sensory to face and teeth, motor to muscle of mastication. Or mastication is the medical term for your chewing. Okay, next one is your A, your end. This one is your abducens. This is motor. This one is for the extrinsic eye muscle. Now we have your facial, your feel. Facial is sensory, motor, and parasympathetic. Sensory taste, motor to muscles to facial expression. When you smile, when you frown, when you do many things in your face, that is the muscle function. And parasympathetic to your salivary and fear glands. Okay, now let's move here to your V, very, your vestibulocochlear. This one is more of sensory. This is for your hearing and balance. Glossopharyngeal for good. This is sensory, motor, and parasympathetic. Your vagus is also sympathetic, sensory, motor, and also parasympathetic. Your accessory here, okay, example is spinal accessory nerve. Okay, that is why we use such, letter S. Or, okay, or sometimes we can use heaven. Means accessory, but it doesn't really sound good. Okay, this is more of motor. And we also have your hypoglossal, which is your heaven. Okay, again, remember the 12 cranial nerves, its name, its general function, and its specific function. And how are you going to memorize it? By using your mnemonics like touch, to touch, and feel very good, velvet. You can use for accessory or such for your spinal accessory nerve. As an example, velvet. I think it's easier if we're going to use okay, like this one. So to touch and feel very good. This one, velvet, it has other one, but it doesn't really sound proper if we're going to use it. So velvet is better. So to touch and feel very good, velvet, heaven. So that the will correspond to your accessories. Again, please memorize. Okay. Now let's move here. Let's clear the up. Okay. Now this one, I hope this one, I discussed this one earlier on how are we going to categorize actually your nervous system. Okay, so your nervous system, there are actually divided into two, right? Your central nervous and your peripheral nervous system. Your central nervous is more of your brain and spinal cord, which we already finished discussing. And we are now moving to your peripheral nervous system. We already discussed this one. It's all about your cranial nerves and your spinal nerves. Okay. However, your PNS will branch out again into two, your autonomic nervous system and your somatic nervous system. Okay. And your autonomic, your ANS, will branch out again with two, which is your parasympathetic and your sympathetic division. Okay. I'll repeat. Now, the nervous system of the body is split into two parts, your central nervous system and your peripheral nervous system, CNS, PNS. Now, your CNS, it is made out of the brain and the spinal cord. Okay, now the brain is the body's control center. We already know that one. The CNS has various centers located within it that carry out your sensory, motor, and integration of data. Now, these centers can be subdivided to your lower centers and your higher centers, okay, within the brain via your effectors. Okay, now let's go to the other side, which is your PNS, your peripheral nervous system. Okay, this one, it is a vast network of your spinal and cranial nerves that are linked to the brain and also to your spinal cord. It contains sensory receptors which help processing the changes in the internal and external environment. This information is sent to your CNS via your afferent nervous system. I mean, afferent sensory nerves. Okay, so your PNS is then divided into two, your autonomic nervous system and your somatic nervous system. The autonomic has involuntary control. Okay, involuntary control like your heart muscle, your internal organs, your blood vessels, your cardiac muscles. Okay, your somatic, on the other hand, has voluntary control of our skin, our bones and joints and skeletal muscles. Like we can move it. We can actually dictate how it will move. That is your somatic. Autonomic, we cannot tell when to stop or when to start. It's because we cannot control it. Okay, now let's go again to your autonomic. It is subdivided into two. We have your parasympathetic division that is usually being utilized during rest and digest, while your sympathetic division is if we are active and alert, or it's something to do with your flight or fight. Okay, so that's how are we going to categorize your nervous system. Now let's move here to your peripheral nervous system. It is consists of all the neurons outside the brain and your spinal cord. Okay, collects inputs from different sources, relays input to your CNS, and perform action. Okay, so they will get stimulus or information from external or internal, and then they will give it or relay it to your CNS. Eventually, it will perform the action. Okay, so just like this one, your afferent and efferent. Okay, afferent is more of away, collects input from periphery and sends it to your CNS. This one, it will go to your CNS. Your efferent carries and processes input from your CNS to your effector. Okay? As simple as that. Afferent from your sensory, the use of your senses. Now your efferent is like the end part, the use of your motors already. Okay, so afferent from sensory going to CNS. Efferent from CNS going to your motor. Okay, example illustration is this one. The brain instructs the body to pull back the hand by sending signals via your efferent. Now, the skin sends the heat, the stimulus through your nerve endings of the afferent using your senses, sense of touch, right? Now, the nerve endings here, the afferent nerves relay the information to your brain. Okay? Now, let's go here to the divisions of your efferent motor. So we have your somatic and we have your autonomic. Okay. Remember, if we say somatic, it is we can control. Okay, the control of your skeletal muscles, and the response here is voluntary. Okay, it means we can manipulate the movement here. If we say autonomic, the response here is involuntary. Okay, this one are like it controls your smooth and cardiac muscles and your glands. Okay, again, if we say somatic, voluntary, we can control. If we say autonomic, it is involuntary and we cannot control. Okay, here the division of your autonomic, your sympathetic, and your parasympathetic. Let's go to your sympathetic first. This one, your blue ones. Okay, what is happening here? This is actually being activated during the time of stress. If we feel stress, our sympathetic nervous system is being activated. Okay, this is the part of our fight or our flight response. Okay, like if there are emergency, when suddenly you can actually carry your refrigerator or your component or your sofa, you can actually do these things. It's because of your fight or flight response with your sympathetic nervous system. Okay, this one, it will prepare your physical activity by increasing your heart rate, increasing your blood pressure, your respiration, sending more blood to your skeletal muscles. That is why you are very alert, inhibiting also your digestive tract. Okay, now let's go to your other one, the red one, that is your parasympathetic, or what we call the housekeepers. Okay, they are activated under normal condition. If we are just resting or sitting or standing or lying in the bed, they involve in our ingestion, in our urine production, and dilatation or constriction of our eyes, of our pupils in our eyes. Okay, that is your parasympathetic. It is more of during your relaxed state. Okay, so that is the difference of your sympathetic and parasympathetic. And with that, it will now conclude the end of our discussion on your nervous system. And again, I want you to keep on reading your book, or maybe you watch um, more videos to make it as your reinforcement in learning this system. And again, thank you for listening, and I'll see you again next time. Goodbye and stay awesome.